Welcome to EnVision Center News, where we discuss community impact and involvement with today's nonprofit leaders and philanthropists.
Becky, thank you so much for joining us on the podcast. Very excited to learn about your organization, Cancer Can't. Even the name, as a marketing branding girl, I love it. But first, let's start kind of before Cancer Can't. Tell us a little bit about you, your life, even where you grew up, maybe your education. We love just hearing about how people land in the nonprofit world.
Well, gosh, I certainly did not plan for this. I grew up in a small town in central Washington, Ephrata, and actually I married my high school sweetheart.
Aww.
His name was Jonathan. And then we both went off to WSU, go Cougs. And then we ended up settling in Spokane, Washington, and I got my degree in interior design and then went into residential construction and worked for the company Camden Homes. They're doing very well, building a lot out in Spokane Valley, and still good friends with the owners of that. And but then I started having babies and became a mom. And then my husband got diagnosed with cancer. And so our kids were 2 and 4 years old when he was diagnosed. And he was in mortgage lending and was working at the time at Washington Trust Bank, and was diagnosed with osteosarcoma. That's a bone cancer. And so his treatment was such that he had to stop working. He pretty much lived in the hospital. And we were a very young family that was facing a cancer diagnosis. And then that's how Cancer Can't happened, I guess. Yeah. So
Did you catch the cancer like early, late? Like where in the timeline did you figure out that that's what he was dealing with?
Yeah, actually, in terms of most cancers, I would say we caught it pretty early. We weren't even 30 yet, so he was having knee pain, and he didn't do anything that would be causing the knee pain. And we were doing all the usual things, ice, ibuprofen, all of that sort of stuff. And it just wasn't getting better. And so he went to the orthopedist, had an image done or whatever, and there was a small shadow on his femur above the knee. And, you get we're going to do some more imaging, 99.9% chance it's nothing, but, we should probably follow up on this. And then after that image, the next call is, we're referring you to an orthopedic oncologist. And so it was at that time only still in his leg. So they diagnosed it based on the size that's what determined that he was stage 2, but it was nowhere else in his body. We caught it pretty early on initially, but bone cancer, that particular type, is pretty aggressive. It's not necessarily one that you want to be diagnosed with. It's now being in this world, there's better cancer than others. Yeah. I guess that's the best way to say it.
Yeah.
Yeah. So.
And then the Cancer Can't came to be while he was still in the hospital, or when did you start kind of thinking we should maybe start some kind of nonprofit or service or something?
Yeah. So, and I really can't take a whole lot of credit for the start of it. It was mostly him. And because he couldn't work, he was pretty much living in the hospital at certain times. It was like he was in the hospital for 5 to 7 days at a time, and then they would, let him out. We would be at home for a little while, and then he had to go back in for every chemo treatment. He was admitted into the hospital because his treatment was pretty severe, I would guess you would say, compared to a lot you can do inpatient at the oncology clinics and stuff. We didn't get to do that. So when he was there, because he couldn't work and stuff, I think he really needed to make a purpose out of what was happening in our life. And he was a doer, and he was fairly successful in the business world in Spokane at the time. And what was the purpose of why we were going through this? And being pretty young, we weren't kids, this wasn't, we weren't dealing with pediatrics. And so we were really discovering that there wasn't a whole lot of resources for adult patients within our community. And he really had a heart for, and eventually we got to a point where we knew the diagnosis was terminal for him. And so he wanted to help the people that were going to come after him. And, if he couldn't make a difference for himself or our family or whatever, long term or whatever, maybe we could, or he could make a point of what he was going through to help other people that would come after us. And so he just felt really passionately about, there's not a whole lot of resources in the, I guess, greater Spokane area for adult-specific oncology. And so we were learning statistics on this. So this is something that I think is interesting, and I usually share it. So for every 113 people diagnosed with cancer, only one of them is a child. So it's less than 99% of people are adults when you're diagnosed. So it's less than 1% actually that's a child. Yet 80% of philanthropic funds that go towards cancer is given to pediatrics.
Yeah.
And so you have this huge disparity of need versus resources for adults specifically. And now you never want to discount, like, one thing we always said was, thank God it wasn't one of our kids, right? Like, no one wants to see, see that. And I mean, so it's not to discount that at all. But, we had a 2 and a 4-year-old.
Kids were affected.
Absolutely, those kids were affected. And, and so it is just kind of something that I don't think people are really aware of that.
You just don't think about it, and it's very easy to create a commercial where there's little sick kids, and it just pulls at your heartstrings.
Absolutely.
But just like we said, maybe an adult doesn't pull at your heartstrings so much when you see them sick. But then when you see the 2 kiddos sitting next to them, or even the spouse or the whoever loved them, going through it with them, then you're like, oh, yeah. There's actually a domino effect here.
Oh, absolutely.
And it's not just adult versus child. There's always adults and children involved.
Oh, absolutely.
With both cases, yeah.
Yeah. I mean, you even start dealing with young grandparents even that, that's still too soon, or whatever. And so, and that there's not a lot of stuff out there to be supporting them through a very traumatic, health, financial. There's so much that goes with a cancer diagnosis that affect a whole family. So, yeah.
And so what were some of the resources that y'all were looking for that you weren't able to find, or just the big gaps that you saw where you're like, okay, we're going to step in and fill those?
Well, we felt very lucky. We had a lot of support from family and friends for us. So some of the stuff that we are doing now we didn't necessarily need, but there are things that people did for us that now have become programs that we're doing that we're like, this actually was a huge blessing for our family. And one of them, actually, we do Cancer Can't Take Christmas. And this is the one area where children are kind of involved. And so when it is a parent that is battling cancer, because there is a huge financial burden on parents around the holidays where, how do you not have Santa come to your house, but you know that, well, come January 1st, guess what? My insurance deductibles start all over again, and I have a, $13,000 bill coming at the end of January. That makes Christmas, scary for a parent.
Yeah.
And so how do we support or help them through that? And so we, pair sponsor families or businesses or whatever with cancer families that have kids, and we get the wish lists from parents and the kids, whatever. And then these sponsor families take completely care of Christmas and deliver to them, and we have elves and kind of, whatever. And so that's kind of a fun thing. But the idea is really to support the adults through that, but the kids also get blessed through that as well. And there were people that did that for us just as a, very kind thing, that it was really cool, whatever. And so yeah, that was one of the things, but yeah.
And so when you formed Cancer Can't, what did forming it mean? Was it one service or program that you focused on? Were you like, we're going to fundraise and then figure out what to do with this money? What did actually starting it look like?
What actually, so because Jonathan was living in the hospital, his treatment was being done at Providence Sacred Heart, so the big hospital downtown Spokane. And they have a whole oncology floor. And there were things that were happening at the time that, and this I think is just kind of like standard, that we were like, dinner and breakfast and lunch is served exactly at this time when they bring it, but, he never feels good at that time or feels like eating. And there's nowhere to put the food to keep it cold so that it's good when he does feel good. And oftentimes there were things that he wanted that either I made or his mom made or that friends made that was, we had, meal trains and stuff like that, but there was nowhere to keep the food cold or store stuff and so there were really no comforts of home in the hospital. And it's, I guess kind of staying, even a motel room has, a little mini fridge, or whatever. And there was no comfortable chair for me to stay and sleep at. There was no, the rooms were very sterile. It was very much like being in the hospital because you were. And there was all, and so.
It wasn't like in a pediatric ward where they do everything they can to make it seem fun and colorful.
Exactly. Yeah. And so we ended up starting by reaching out to the Providence Foundation director. And we're like, hey, so we want to do stuff to like remodel this floor and do some stuff so that other patients that are like us that are essentially having to live here, like there's some things that we could do better that would really support just what this would look like here. And so that was our first project, was we worked to remodel the oncology floor at Sacred Heart and got, refrigerators in all the rooms. And then we worked with the foundation and even bought, through a thing called the POUR, we bought new bed, helped get new beds. And
so this wasn't through chairs. Funds that y'all
some of them were okay. So we did the refrigerators, the chairs, we did that, but then eventually we even were partnering with Providence and that sort of stuff. And so that was initially what the vision started like, but we actually raised more funds than what we even needed to be able to do all of that. And so then it kind of led into the next thing where we're like, okay, so now what's the next need? What are things in the community? And that was kind of, we started this tradition with our board where at the end of a board meeting, okay, what crazy thing is needed that we might just be able to do, or whatever. And so, that then, rolled into, we ended up creating a medication repository system and passed legislation to allow medications to be donated to get patients that can't afford meds. So you can now donate meds in Washington. And so passed legislation and did that. And then slowly the program started coming on for helping patients get to treatment, from transportation to grant programs, whatever. And so just year after year, as we've continued to grow and people have more ideas and more things, then we try to address them. And so here we are. Yeah.
Okay. So it's kind of issue by issue. They come and then you figure out if you can solve the problem or contribute to solving the problem. Do you primarily still serve just local populations?
Well, so to start out, we really were mostly kind of in Spokane. I mean, I guess we're just really started out at the hospital. And then, but we have hit our 10-year anniversary. Last year was our 10-year anniversary. And we have definitely grown outside of, the greater Spokane area. So we are hitting all the way from Moses Lake down into the Tri-Cities, even hitting patients through to Montana and all across through, the panhandle of Idaho.
And that's in the ways that they get access to the repository, or what are the ways that the people that are far
I guess
out?
So some of our programs, I guess, the biggest program that we have now is our transportation program. And so we have gotten funding through the STA and now WashDOT. And we have created the, Greater Spokane's largest volunteer transportation system. So when you think of cancer patients, when you have a compromised immune system, it's really not a great idea to get on a public bus. And from appointments changing and different things like that. So we essentially created a volunteer transportation, drive program where, and a lot of times families and neighbors and friends kind of do this already. If your neighbor is dying, well, they need a ride to get to treatment, or whatever. And so a lot of people are doing this sort of already. But what about the people that don't necessarily have a support system? Either they're a widow, they're alone, elderly, or even your spouse can't get off work. You are, whatever, but you can't drive. So there's a lot of scenarios where you do need support. And so you can volunteer as a driver, and then we work so closely with all of the oncology clinics in like this large community from, Post Falls, Coeur d'Alene, Spokane, North Spokane, there's a lot of the treatment centers have sub-hubs, if you will, that they're doing. So we work with all the social workers, all the treatment centers, even hospitals, actually. And so when they have a patient specifically that, hey, they don't have this support system for this, they need a ride to these appointments. So we have a dispatch center where we have staff that then partner that need with our volunteer base. And so you kind of send out, hey, this is a need, and through different programs and stuff that we have, the volunteers can pick up. That works with my schedule. I can drive that person. And so it's not something where you're saying, I need to keep my schedule open every Wednesday from 12 to 4 o'clock. We run it very differently, where it's kind of like we throw the need out, and then we have enough volunteers or the volunteer pool where you can say, that works with my schedule. I'll take that ride. You have like a
little Uber app?
It's kind of like that. Yeah.
That makes a lot of sense.
Yeah. And so, but where we've now grown so much is we're starting to get the need from the more rural communities, that it really was just Spokane, but now we are getting rides. We need a ride from Soap Lake to Spokane, that's 2-hour drive. We're needing a ride from Sandpoint to Post Falls. Mm-hmm. And so starting to really grow into more of these rural communities, where we need to start growing our volunteer base in those areas, so that we are not sending a Spokane volunteer to Sandpoint to pick up the patient to then drive back to. Do you see the problem? Yeah. So it's we need to be growing our volunteer base more in these rural communities. So that's something we're working on.
Is that your biggest need for folks who are listening who are based out of Sandpoint and the greater Sandpoint area or Bonner County, is that you need drivers?
Absolutely. Okay. Yeah. And we're even starting to, our latest conversation, which this program doesn't exist yet, but we're in the talks of even things like childcare. So like as you have a mom that's diagnosed with colon cancer, breast cancer, whatever, dad is having to work. Well, what do you do with the kids? Whatever. And so we're even kind of talking about grandmas that, want to babysit while, someone's getting treatment in addition to a ride. So yeah, it's some of that sort of stuff. But yes, we need the volunteers. That's our greatest need right now. Yeah.
And so do you have like an actual like brick and mortar office space in Spokane?
No. So we, all of our staff are actually, part-time that work from home. And so one of the things that we've really prided ourselves on is that our overhead cost is very, very small. Mm-hmm. And so most of our staff is either directly associated to the programs like dispatchers that are directly serving patients, and that sort of stuff, or volunteer recruitment and running that sort of stuff. But we don't pay for things like rent and, and that sort of. So I've been doing this for 10 years and sometimes at a full-time level as a complete volunteer. I've never taken an income or done any of that, just to sort of, it's a passion and was something that my husband believed very much in. And so I could never take money, and I can get more staff. I can pay someone else to do it. We can accomplish a lot more. We just work so closely with all of the oncology clinics and their social workers and staff that they have all of, our employees on speed dial or whatever, and know all of the resources and programs and that sort of stuff and schedules. And it's worked out great. I've gotten some really amazing employees that are probably very overqualified, but they have the freedom of schedule to be with their families and that sort of stuff, don't have to go into an office. And so we were doing the work at home before COVID made it cool. So
Yeah. So why do you think Cancer Can't has grown so much? Somebody might be like, at least first hearing Cancer Can't, another cancer nonprofit. There's a million bajillion of them, it seems like, cancer nonprofits, yet here you are growing and thriving and being fairly young compared to some of the others. Why is it that you are? Is it just that you're providing that localized support, and most cancer organizations are focused on research or something else? Like, what is it that's made you so successful?
I think that really the people that once you get involved with Cancer Can't and you meet the people that are involved, it becomes very apparent, the heart space and stuff that is, and the love and compassion and empathy and understanding that is really behind who we are. It's a very organic, I like pay it forward type of movement. Like Jonathan and I started this as, we're going to wrap our arms around the people that come behind us and help them. And then, those people that have been helped turn around and help the person behind them. And so it is a very genuine, heartfelt, and the people that are within it, then they become a donor, and then they bring it, whatever. It's really amazing how many we came to this fundraising event, and sadly, 1 in 2 men and 1 in 3 women will receive a cancer diagnosis in their lifetime. You don't know anyone that doesn't have a cancer story, basically, or that doesn't have some sort of connection. And so when you come into something like that, or then it hits you, you're aware of who we are, and then it hits your family or something like that, to come into a community, basically, that can sit across from you at coffee or whatever, and instead of saying, I can't imagine what you're going through, we can say, we know exactly what you're going through, and these are things that we did. This is what we tried, this, whatever, and what other things can we do to, we know the things that you need and how we can support you. Even that's just the people within Cancer Can't, outside of our general programs, just serving the community. That is our donor base. That is our volunteer base. Many of our volunteer drivers or volunteers are either cancer survivors, spouses, or whatever. Yeah. And so even as you're driving these patients, it's a very personal, I'm doing this because I want to give back because somebody did this for my wife or my, or whatever. And yeah.
Cool. And what kind of events or fundraisers? I mean, every nonprofit on earth needs more money. How are you? What's coming up for you where people can donate or attend or contribute financially?
Yeah. So I guess a couple of things. So our big thing is we do it's a black and white gala that happens in September. This year it's September 13th, and it's going to be at the Davenport Grand. And it's become quite a large event. Last year we sold over 900 tickets. And so it might be getting up to one of Spokane's biggest event, if not the biggest event in Spokane.
That's amazing.
So it's a ton of fun, and a lot, you'll know someone there for sure, it seems like. But it's a great silent auction. All of this stuff is online. I want to say that, gosh, I don't want to misspeak, but we were probably somewhere around $200,000 in donated things. And so you can do your Christmas shopping there, you can do, or whatever, knowing that where the money is going because it supports all of these programs. So to get involved, come and get involved, and, participate in the auction. But also, as it's getting so big, really, again, getting these silent auction items. This is how all of the money that is raised from that is how we run all of our programs. And so if you make cool things or own a business or a restaurant or whatever, we would love a donation in terms of a gift certificate or an item or something that
Are we
someone
talking
would
like
buy.
only like really bougie items? Because it's like what types of items are you auctioning off?
We definitely do really bougie items, but we also do, like really. We also do some like, oh gosh, it's a $20 gift certificate to Dutch Bros, that sort of stuff. That is like, because the other thing is that there are people that are like, hey, I don't have a whole ton of money. I bought a ticket that was, $130 to get there. That, might be a lot of money for them. And so they know a portion of that is a donation. And you get to the paddle raise, and I was able to raise my paddle for $50. And like, we are not like, this is where like, we are an organization that is for everyone, because even if that's all you can do, and that is even I just think of my niece, actually. She worked as an oncology nurse. Like that was what she went into after my husband passed, like passionate. But like I remember the first time she was able to come to the gala, and she was so proud of herself because she was able to donate her first, she's 19 years old and paying for whatever. And she was like, I'm donating $50, whatever. And so that might not be the, $2,000 paddle raise, but like, that was probably more money, her $50. So
as a percentage of what her paycheck was, or what she has in her bank account.
Yeah. So it was really about the heart space of like what you can give. And that's really, again, that's who we are. We aren't just, a bunch of, if that makes sense, like we are for everybody. And that's, and I think that that's what people, I think, feel and understand when you get involved with Cancer Can't.
Okay.
Yeah.
Is there anything else that kind of, other than the need for volunteers to drive, any other way that people who are like, I'm not going to the gala, I'm up here in northern Idaho, or any other needs or things like that you're looking to, and that maybe the child care is that, and there's nothing really else that's coming down the pipe that maybe people here would want to know about, get involved with, volunteer for?
Yeah. I mean, like our website is cancercant.com. Yeah. Pretty easy to remember once you remember our name. But, check out the website, and, you can sign up to volunteer, and there's different things that you can do in terms of, auction item procurement. If you just are willing to, stay at home and call some people or whatever and get some things that come in. So we have all kinds of different things that you could get involved with for volunteering. But yeah, I mean, we also have we're working on building a lodging facility in Spokane. So I would, that's kind of a big deal for us. It's about a $6 million project, but it's again focusing on rural patients that are traveling to Spokane for treatment. There's nothing that we have to house adult patients. And so oftentimes we hear like, so it's kind of like a Ronald McDonald House, but for adults. And so like, yes, kind of, but also no. It's a very different business model. Actually, we were trying to be very creative with what we did so that we weren't constantly having to raise funds to maintain the program and the facility. And so it's basically like an apartment complex, and some of the units were partnering with like some other medical services for like transplant patients, cardiac patients that have to also be near the hospital, but they're paying. So it's kind of corporate rental where we would be able to make revenue that then pays for the cancer patients. And then if you're doing radiation or something and you can go home on the weekends, we can short-term rental those. So VRBO. So another thing is if you are coming to Spokane in the next, when we get this thing built and you need a place to stay, check into that because even just, staying at the VRBO at our Cancer Can't Lodge or whatever, your stay will pay for a patient to stay after you. Yeah. So, so we have the opportunity to kind of produce revenue, and that supports patients or will support patients as well. So yeah, we're working on getting that taken care of and built as well.
Amazing. Is there anything we missed? Like what else have we not covered? Anything that you want to make sure people know?
Gosh, yeah. So we also have we have a grant program. So it's like emergency funds for patients that, upon diagnosis, all of a sudden you can't work, you I mean, like it's a financial, cancer is a financial burden for sure. And so that's something that we do. We partner with Cancer Cure Northwest and also manage their foundation funds to get those for patient needs as well. So all of these sort of things really, again, like any nonprofit. Well, if you also just want to donate, money goes a long ways too. So you know, that's something. But yeah, I'm trying to think between transportation, grant, Christmas, lodging. Those are really our big things that we're doing for patients. But
That's
yeah,
a lot.
Yeah.
That's plenty. It's not like I'm expecting you to have a list of more.
Nope.
I mean, even just the transportation program alone could be enough to drive a nonprofit. I feel like that in and of itself is an amazing service. And then you add on all these other things, and what you're doing in 10 years' time is incredible.
Yeah. We've had a lot of volunteers actually say that they end up probably getting more out of the experience than the patient in some ways. You know, because it's cool because especially if you have a pretty flexible schedule, we can try to pair you with the same patient consistently. And so you would develop, and this happens often, like our volunteers kind of develop a relationship or friendship with that patient and get to know them a little bit and follow through, you know, like even like, oh, their kids start texting and checking in. How are they doing after, you know, like treatment or stuff like that. And so, so there's a lot of cool stories that we get to hear out of that. And so, yeah. And if you have a flexible schedule, but it's also very, you know, if you're just off on Fridays, well, if that works for your day, you know, your schedule, we're flexible with you too. So yeah.
Awesome. Well, thank you so much for the work you do and for continuing to do it. Like I said, what you're providing is incredible. And I hope that, you know, your programs continue to grow and we see more involvement in the Northern Idaho area too. People volunteering and using the services and then, you know, flipping and like you said, and then turning around and giving back again once they get through their own cancer treatment or whatever the case may be. So thank you so much.
Yeah, no, absolutely. We're really grateful for the opportunity to kind of, you know, looking how do we, you know, spread the word about who we are. And so we're kind of reaching out to some of these rural communities because we are already serving some of the patients, but, you know, now we've got to get the volunteer pool and kind of get all of that stuff going. So really appreciate the opportunity to come here and share a little bit about what we do.
Thanks for listening to today's episode. For more information, you can go to crecIdaho.com. Please like, share, and subscribe. We'll see you again soon.